the video in the point, they talk about making that little mitt to wash people. You're welcome to do that. But most of us, I've never seen a nurse actually do this. If I did, it was like because they were a new grad that just graduated. So you're welcome to do that. And then you can just wipe their face. I usually just do just water, okay? There's many ways to do this. I'm gonna show you the way I do things. So just a regular face cloth and just regular water, no soap. And I wash their eyes inside out, and then I wash their face like I would anyone else. Now, because I'm at risk for fluid exposure, they could have poop, pee. I'm going to put gloves on. We have these little hair nets. It's kind of like a bonnet you put on. If I wanted to wash his hair, I could put one of those bonnets on. You wash their hair, there's shampoo inside there. You take the bonnet off and dry their hair and comb it. We don't have any here. So I got my regular bath wipes. Now I'm going to tell you about a third wipe here. These are perineal wipes. It'll actually say perineal wipes on here, or it'll say, in this case, it says barrier cream wipes. These wipes, they have a little bit of barrier cream on it, so that gives a little protective film on the skin. We want to protect the skin because moisture and diarrhea and they can cause skin breakdown. So this helps protect from that. Okay? So this is going to be for his whole body, for the perineal area. And then I already used just a plain face towel to wash his face. Put these here. I'm going to remove the blankets. So anytime someone gets a full bath, like I'm about to do, we usually change all the linens too. What you don't do is throw linens on the floor. They would go into a hamper. Okay, can you bring me that hamper over here? We want to keep our floors nice and clean. So I'd throw it in the hamper like this. For practice today, you don't have to do that. Just put it on the side and we'll fold them and reuse them. So the trick here is you want to keep them covered as much as you can without exposing them, okay? Because it's awkward, right? It's going to be awkward for them, awkward for you. So how do you get by that? That's where communication comes in. This is the time to start just small talk. Where are you from? How many kids you have? Anything you want to talk to them about. What do you like to do for fun? What you don't want to do is have that awkward silence. They're uncomfortable, you're uncomfortable. It tends to help. So I got him covered. I'm going to remove the gown. So I untie the back of the gown. And then watch how I remove it without exposing the patient. Into the hamper. I'm always telling the patient what I'm doing. All right, sir, I'm going to wash your chest. If it was a female, I'd say, is it all right if I wash your breasts? Most people don't care. We have to clean under breasts, so we don't grab them, lift them up, and clean. The more appropriate thing to do is you just use the back of your hand. Lift it up and then clean them. So I would, if this was breasts, I'd lift up the breast and clean underneath. I'm gonna work my way down, not exposing the patient. Now I usually, and then this would go in the garbage, I get a new towel. But to save our wipes, I'm gonna keep using the same one. And then usually I would get a couple towels, at least 3 or 4. I'm gonna wash his arms now. I like to put a towel under, and then I just wash the arms. I'm going to use my perineal wipes. All right, sir, is it okay if I wash your penis? All right, thank you. So, with the penis, you want to clean the tip first. If they have a foreskin, you're going to peel back the foreskin, clean the tip of the penis, and then work your way down. You want to move from the top down. What you don't want to do is take dirty poop and stuff and move it up, because then you can get it into the meatus and cause an infection. Clean down here, front to bottom. Now, for the vagina, catch. Oh, I love doing that. All right. For the vagina, front to back, always, okay? Never back to front, same reason, they'll get an infection. And I always see students, sometimes they're like this. It's like, no, you have to get in there, get in between the labia, front to back. What you don't do is front to back, take that same cloth, front to back. You're just taking dirty stuff here, bringing it up, and then smearing it into the vagina. So it'd be front to back, and then leave it there. Get a new wipe, front to back, tuck it down there. And then I like to take, if they're wearing a diaper, I would tuck it all in like that, keep everything contained. So now the front is done. Now I need some help. I'm gonna cover her up again. Now I need help. This would be a two-man job to turn somebody who can't help. If he was independent, I would say, sir, can you turn on your side? And then I'd do his backside. You wanna give me a hand? So these chucks serve as two purposes. This is called a chuck, and it can help if the patient soils themselves. It can help so that we don't have to change the entire bed. We would just change the dirty chuck. And then we also use them to help reposition patients. So you're gonna reach over, grab this, and then you pull the patient this way. And then you can also bend their knee. You say, all right, sir, on the count of 3, pull here. 1, 2, 3, over. And then let go of this, because this is all the dirty stuff, and you're just gonna support them with one hand here, over here, and one hand there. Yep. All right, so you see now I got all my dirty stuff here. I gotta get rid of it. So I'm gonna take my dirty, roll it up. You can also get my perineal wipes. I'm gonna finish cleaning front to back. Tuck that dirty stuff in there. I'm gonna get my regular wipes. I'm gonna wash the patient's back. All right, so now you as a student, this is your chance to really butter up your patient and kind of turn that charm on. So you want to ask them, hey, you want to have a back rub? A lot of nurses won't do it because we're in a hurry. That's just the reality of it. But students are not in a hurry. You guys have lots of time. So this is when you can offer a back rub. And then you just find some moisturizer cream. Make sure it's not barrier cream. Barrier cream would go here. And it's similar to those barrier wipes. It's just like a glazed donut that you put on there to help protect their skin. So I would get some moisturizer and I would just rub their back. Now we're not masseuse, so you're not like, getting knots out or nothing like that. Just a regular rub down, okay? So now my bath is done. What's coming up next is pretty much what's considered making the occupied bed that you guys probably watched the video already. So I'm going to take a new fitted sheet. Fitted sheets are the ones with the elastics in the corners. Make sure there's no wrinkles. Wrinkles can cause skin breakdown, okay? I'm gonna have a new chuck. Just roll up my chuck. In the hospital, these chucks are disposable, okay? So it's usually like a one-time use. When it's dirty, they go in the garbage. Here in the lab, we reuse these. All right, I think I'm ready. Now I'm gonna roll him back. If I wanted to put another diaper on him, I could, like this. Nursing homes, they tend to wear diapers. In the hospital, it's usually just the chuck. That's how I'll do that. He's gonna roll onto my clean diaper. All right, sir, we're gonna roll you back towards me. I'm gonna come over here, grab his, keep him covered the best we can. I'm gonna roll him this way. Now you're gonna take, and she would be wearing gloves. It's okay for now. Take all my dirty stuff and throw it in that hamper. Perfect. It's good. Get my, and then yeah, make the bed over there. And then I can hold him and support him. Good. Roll him back. I'm gonna put the diaper back on. The straps go in the back for a diaper. Straps in the back. That's the back side. Oops, sorry. Did my Canadian accent come out there? Sorry. Sorry, eh? I'm gonna put a new gown on him. So what I like to do is I put my hand through the hole, the armhole. You can do the same. Grab his hand and then just slide it through. And then people ask, how do I tie the back of the straps in the back? So these straps are long. You just slide one under his neck and then tie it on the other side. Yeah, we'll get it. All right, so the gown's on. Now I'm gonna remove the towels like a magic trick. This would go in the hamper. Now we have to make the top of the bed. We never open up linens like this, okay? That just moves dirty air particles around. It's the wrong sheet. You more kind of unfold it on the bed. Can help me. There we go. So we are just gonna drape this. Just gonna drape it over like this. Can you pull it your way a little more? So you check out this line, the laundry department, they actually fold these blankets strategically so you can see a line down the middle. That tells me it'll be equal on each side. We're gonna do the same with this one. Okay, grab it like this, the two together. And then we're just gonna hold it again. There, it's good. Now, down here at the bottom, you gotta lift it up and tuck it under.